So I was graduated in the National University of Singapore. I started the training in the internal medicine and subsequently medical oncology that specialized mainly in lung cancers and head and neck cancers. The main reason why I developed an interest in this is my experience. I managed to receive good training at good centers. And in 1992, I got a scholarship to did a stint in Japan, in Tokyo, their National Cancer Center. And I managed to receive 1-year training stint under the MOH Ministry of Health Scholarship in Sydney doing bone marrow transplant, or rather we call it high-dose chemotherapy. That time is in early 1990s. Clinical research in Singapore was non-existent. That we started clinical research infrastructure. Now there's lots of ongoing development, improvement, new drugs, new treatment. So I think the most challenging part is to keep yourself up to date. The aim of the treatment is to see whether we can control the disease, to control the symptoms, to prevent complications, make them more comfortable, improve the quality of life, and hopefully at the same time extend their life. Most of the chemotherapy drugs now do not cause significant nausea or vomiting. It's because they are newer drugs that have less side effects. Or the newer treatment for cancer is what we call targeted treatment. They target the cancer cells and without affecting the normal cells. Even the conventional classical chemotherapy, the side effects is less. I think it's important to spend enough time with the patients, basically to empower them, not only for them to decide on the specific treatment, and also for them to decide what they want to do with all other aspects of life. Our aim is for patient to live a life as well as he can be, given his condition, for as long as we can do it, and for patients to cope with the illness and to live on. So if we can achieve all these things, we also feel gratified. And I usually start my day off with the patients in the ward. And we usually stay in the clinic until about sometime in the evening, 5 o'clock, 6 o'clock. Then we go back to the ward to see the patients again, to make sure things are all right before we go home. The day that I will feel happy is I can do what I need, spend enough time with all the patients. But I think the important thing is, once you feel that you can help patients, you manage to do what medical science can provide for the patients, what we can do for the patient. When you see some of these patients, you admire them for different reasons. One is for the ability to accept the disease, their resilience, and for fighting spirit, they go all out. Usually, I tell the patients, don't plan their life around their treatment, or rather the other way around. Plan their treatment around their lives. Life must go on. Having a diagnosis of cancers, and it's not easy to say, don't think too much about it. But we'll try to help them to achieve that.